for being here today and putting out.
I'm Christy Lee with breaking news. Boston Mayor Marty Walsh with the coronavirus update. Let's listen in live.
From my administration, State Representative China Tyler, City Councilor Anissa Sabi George, members of the Public Health Commission, Bob Luz from the Mass Restaurant Association, many of my cabinet members, in case we have any questions that need answered. This continues to be a very rapidly evolving situation, and you play a vital role in getting the current and accurate information out to all our residents. Today, I'm going to talk more about the plan for the closing of the Boston Public Schools to students. I'll address issues around bars and restaurants, but first, I have an announcement that I want to make. Effectively today, we are declaring a public health emergency in the city of Boston. And the reason why we have one in the state, we have one in the country, and I'll explain this to everyone now. The work to make this decision began last week as part of our planning to support students who are out of school, but also goes beyond the larger situation at hand. Declaring a public health emergency will enable us in the city to deploy all our resources and personnel necessary to meet the needs at any moment. It will authorize us to issue additional directives as different situations develop. It will facilitate coordination across city agencies, including the Boston Public Health Commission. Just as important, it will increase cooperation and coordination with Boston's hospitals and healthcare providers. And it will assist us in seeking additional resources and supports from the state and the federal government. We make this decision to bolster our response to the many impacts that are underway, and also gives us greater ability to respond to emerging developments, such as the likelihood of community transmission in the city of Boston. We're experiencing a public health emergency in the city of Boston, and we need to activate every resource at our disposal. In one important example, the declaration will enable the Boston Public Schools to quickly implement plans to support students and families while schools are closed. They will be able to get services in place without going through the usual procurement process, and I want to say more about what those plans are now for our schools. As we announced on Friday, the Boston Public Schools will be closed to students as of this Tuesday, March 17th, until Monday, March 27th. If need be, and we can end the emergency, we'll go back to school sooner if we have to. If we can safely reopen our schools, we will do that. Schools will be open tomorrow to allow students to gather their belongings, families to collect medications, and teachers to share learning materials. Buses have been cleaned and disinfected and will run on normal schedules. There are two exceptions to tomorrow's opening for Boston Public Schools. The Elliott School campuses in the North End remain closed after a non-student member of the community tested positive last week. And the McKinley School in the South End will also not be open tomorrow. A non-student member of the McKinley community is currently being tested for COVID-19. Out of caution, we are not going to open any of these three McKinley buildings on Monday. The students and the staff and the families have been notified. If the person being tested comes back negative, we'll make time for the students to gather their belongings and materials when appropriate. If the student positive comes back negative, we will not have students go back into the building, and we will follow up with the next steps. The plan to support all our students during this time has two main areas of focus. First, making food available to children who rely on free meals we serve in our schools. As I mentioned, Friday, 72% of the Boston Public School students qualified for economically disadvantaged. And in fact, we offer free lunches and breakfasts to every student who walk through our school doors. We're committed to feeding our students throughout this period. Starting Tuesday, families can pick up a variety of packaged meal options at dozens of locations across Boston every day from 8:30 to 11. They have been notified where those locations are, and you can also access that website, boston.gov/corona, so that people can find out more information. I want to be clear, no child in the city of Boston will not be provided a meal if they want one. Boston Public Schools will be sharing those locations, and we're going to continue to update parents as we move forward. And more food access will become available through city agencies and nonprofit partners, and we're coordinating services right now with all of our nonprofit partners who have been doing incredible work. The second main focus of Boston Public School Plan is continued student learning outside of school facilities. Schools will be sharing printed learning materials tomorrow for students' use at home. Those materials will also be at the food access shelter site, so if parents don't get them tomorrow, they'll be able to get them when they on Tuesday, Wednesday, when they go and pick up free lunches and breakfasts. Materials will also be made available online through Google Classroom. Every student already has a Boston Public School Google account, and these online tools are already at use in many of our schools. We understand that home access to devices and to internet is an issue for many of our students and their families. We are working with the internet providers right now on free and low-cost service. We're also going to provide a Chromebook to take home for every single student that needs one. Details on distribution are going to be available in the coming days. The superintendent has been working on that plan with her team over the last 48 hours. We know that families of English language learners and students in special ed programs have particular needs. BPS team will be meeting online when possible with families, students, and with special needs to ensure the continuity of learning to support their IEPs. This is our obligation, and we take this very seriously. For students nearing graduation, we will work to ensure they have access to AP and SAT materials, as well as other college and career exams. And for students at risk of dropping out, Boston Public Schools will be working with its Re-Engagement Center on measures to ensure students remain engaged in the coming weeks ahead. We're also encouraging students and families to use materials, create daily routines, and as much as possible to avoid lost time of learning to keep our students positively engaged. The information that we're putting out there is going to do this. We also need to be aware that childcare needs that these steps present to families, and the fact that many providers themselves are having to close temporarily. We're in conversations right now with the City Hall, many people here, with child care providers and employers to assess that level of need, and we'll be working together on plans moving forward. Obviously, this remains an evolving situation on many fronts. We're dealing with every issue that confronts us as residents. We know it's a lot, but please trust us. We are working on them, and we will continue to communicate any guidance that we can to address them. One issue that we have new guidelines for and regulations for ready, and we're announcing them right now, are for our bars, restaurants, and clubs. Based on what we saw Saturday, I directed our licensing board to be proactive about preventing large gatherings. At least 14 bars and restaurants in South Boston agreed to close their bars and doors today. I want to thank them for being responsive. Moving forward, we're imposing these regulations on restaurants, bar rooms, and clubs. They're going to be required to reduce capacity to 50%, which means they're going to have to remove tables and chairs to reflect the reducing capacity, to follow the guidelines on social distancing, and allow no lines to form outside the establishments. Closing times, as of now, will be 11 p.m., and the violations and violators of this will be shut down for automatically 30 days. This applies to anyone with a CV license. An example of that is coffee shops and pizza shops, as well as large establishments. But this does not apply to delivery or takeout or drive-through services. Those can operate through normal hours of operation. We're working also to support our small businesses, so we want to be able to, if people want to get a meal and go out, or get a meal and take out, they'll be able to do that to keep our service workers employed. We are lifting up regulations so establishments can serve food in takeout. So we're basically, in all intents and purposes, allowing every single establishment that serves food in the city of Boston to have takeout. Even if you don't have a license today, you'll have the ability to do that tomorrow. We're encouraging use of delivery service for businesses that currently do not have a delivery service. Our Office of Small Business is ready to help. You simply have to call 311, and our office is ready to work with you on that. In addition, beer gardens will be shut down until the public health crisis is over. None of them have opened, which means they will not open until this crisis is over. More information is also available on the website of the Inspection Services Department, so any questions that people might have, in businesses in particular, go to the Inspection Services website. I also have to send a strong message to anyone who is thinking about going out and being in big crowds. This isn't about you. This is about your fellow Bostonians. It's about your grandmothers and grandparents. It's about your neighbors who are sick. It's about children in your business with asthma, in your buildings that have asthma. The tradition of St. Patrick's Day celebrates is a community that survived hardship because of social solidarity. That's what we need right now, social solidarity. This is a time of shared sacrifice, and I know firsthand that we are capable of that here in the city of Boston. The bottom line is that social distancing is not a vague, wishful strategy. It's backed by science and data. What we do in our city over the next week or two will make big impacts on the local trajectory of this outbreak and our hospital's ability to handle it. It will save lives. Our numbers of cases in Boston went up to 29 as of today, and 138 cases in the state. We're expecting that number will grow, and we're preparing accordingly for that. We have a citywide public health emergency in place, along with similar in state and federal declarations. We also remain in constant contact with our state and federal authorities and our medical providers here in the city of Boston. We remain in the service of the people of Boston. Our Age Strong Commission is working with our seniors and our senior buildings and the private buildings and service providers. We have an agreement in place banning evictions while this emergency goes on in the city of Boston. We're coordinating with nonprofit organizations on food access to the residents of our city. City Hall remains open, but will continue to impose travel restrictions for city employees and limit on city-hosted events. We're working with private organizations to do the same. If you do experience symptoms such as fever, coughing, or shortness of breath, please isolate yourself and call ahead before going to the ER or a healthcare provider. We're asking you not to call 911 for testing, only for emergencies. Call 311 to connect to the mayor's hotline, and we can get you the most up-to-date information that we have. The city and the people of the city are rising to meet this challenge, and I want to say thank you for that. I want to thank everyone who's participating in good hygiene and social distancing. And I urge everyone to keep it up. Keep washing your hands, sanitizing your hands, cleaning surfaces, cover your mouth and your nose when you cough. Avoid contact with large crowds, avoid contact with crowds. Please remember what social distancing involves. It includes avoiding any type of crowds of any kind, keeping a distance at least 6 feet from any other people when you're out and about. Remember, this is not a snow day or a time for visiting with friends. What we hear loud and clear from the public health experts is that this week is critical for flattening the curve. I'll say that again. This week is critical for flattening the curve. I know it's difficult to keep it up, but please, we need people to know that you are making a difference to keep our numbers down. Because of these steps, we can slow the spread of this virus. It's vitally important that we listen to the public health officials. I also want to ask people, don't listen to rumors. If you're not getting the information from one of the news stations or the papers, it's all rumors. We'll have a greater capacity in our hospitals to treat those in need if we're able to keep the numbers down. And we'll be able to protect lives of our elderly and medically vulnerable residents. The more seriously we take this situation now, the sooner life in our city can go back to normal. The vast majority of our city is showing that we care about each other, and I urge everyone to be part of that. And to those feeling isolated or afraid, especially our seniors and families with medical or fragile children, I want to let you know that you're not alone. There are many dedicated public servants in this building that have been spending almost 24 hours a day over the last week working to make sure to keep you safe. We want you to know that we're doing everything we can to keep all the residents of Boston safe. You are at the front of our minds all of the time, and we're doing everything we can to protect you. I want to encourage everyone to reach out to a senior that you know, a resident with disabilities, and a family member with medically fragile children, by phone, by text, by fax, by FaceTime, or Skype. Fax is a thing of yesterday. We want you to make sure you touch base with them, check in with them to see how they're doing, ask them if they need anything. When you bring it to them, just knock on the door, drop it off, and let them bring it in the house. It's the best way to keep them all safe. We want to continue to protect all of those vulnerable folks through social distancing. But we also want them to know that they're not alone and that we care about them and we love them. Keeping our distance is an act of human solidarity right now. It's about serving others while looking out for each other, and especially those who are vulnerable. I want us to remind people of that. The knowledge that we are in this together will sustain us through very difficult times. I want to thank you, and I'll take some questions.